All right. Hello, everyone. Thank you so much for joining our webinar today. My name is Emma Sears. I'm the Programs Coordinator at the Parkinson Association of the Rockies. And today we'll be keeping it social with our speaker, Rachel Johnson, who is a speech therapist. A few things to get started with. Just some reminders is that we'll be doing a Q&A session at the end. There's two ways that you can all ask questions. You can either type your question into the questions panel or raise your hand, and then I will click on you and you can unmute yourself. This webinar will be recorded and then uploaded to our YouTube channel. And then please fill out the webinar or the webinar survey after the presentation. It'll show up on your screen, and then it'll also be sent in a follow-up email. All right, well, that is all I have for now, and I will turn it over to Rachel.
Hi, everyone. Thanks, Emma. Show my screen. Okay. Can everybody hear and see me? I'm not going to get feedback, but Emma, can you hear and see me okay?
Yeah.
Okay, wonderful. Okay, so today I'm going to be talking about keeping it social. And as Emma had mentioned, I'm a speech language pathologist, and I do specialize in the evaluation and treatment of individuals with Parkinson's disease. And today, Emma had asked me to kind of pick a topic of interest, and I know as a speech therapist, we often choose you need therapy, make sure you're evaluated and treated by a speech language pathologist, but I wanted to focus my attention on another passion of mine, which is making sure people keep it social. Because I think oftentimes with Parkinson's disease, we have a tendency to socially isolate, and it removes us from our friends, family, and sometimes hobbies. It affects the communication at our homes and in the community. And so today, I hope you kind of learn about why there is this issue with social isolation, and then some tips and tricks to kind of avoid that. So let's get started. Here we go. Okay, so just the definition of Parkinson's disease, which you probably all know, but it's an issue with the dopamine center in the brain and how it affects the body. Some of the cardinal features are that rigidity, slowness, tremor, postural instability, mobility issues, and things of that nature. These are some more motor characteristics. I think it's very important, and I'm sure you've heard this before, that once you've seen one person with Parkinson's disease, you've seen one person with Parkinson's disease. And this is really important because each person is very different, and your treatment and your goals and what we expect should be individualized. So some of the motor characteristics that I just mentioned, but more specifically are the tremor or shaking, freezing and slowness, reduced arm swing, micrographia, which is that small handwriting that we often see, low vocal volume or dysphonia or hypophonia. This is when people are talking in that more quieter voice, muffled or slurred speech, which we call dysarthria. That's when people say, I feel like I'm slurring or my tongue feels thick. Hypomania, which is that flat facial affect, limited expression. Obviously, rigidity in the arms and legs and core. We also see rigidity in the facial muscles, that kyphotic posture, that stoop posture, and then some motor characteristics is that drooling or choking that we see. That's more internal, but can occur in Parkinson's. This slide is really important to me because I think we often concentrate so much on the motor, what we see, physical characteristics, but there's a lot of non-motor characteristics that we see in Parkinson's and that you may be dealing with, and that's that depression and anxiety, attention issues, cognitive changes, confusion, panic attacks, sleep issue, constipation issues, bowel and bladder problems, reflux, pain, and the two at the bottom I think are very important. They're the social isolation and the cognitive decline. And I think those two things go hand in hand, and we'll talk about that a little bit as we get going. So one of the major speech and voice issues that we see in Parkinson's is a hypokinetic dysarthria or hypophonia. And what we see in the voice is hoarseness or raspy or breathy voicing, low volume. The resonance can be hyper or hypo phonation or nasality, so you kind of feel that stuffed up or congested sound in your speech. Prosody can be very flat. We can see that people have more hesitation. They can even develop disfluencies or stuttering in their speech, difficulty with articulation. And some of the motor characteristics we see in the physical, we also see in the speech mechanism, which is that freezing of speech, rigidity in the muscles, inconsistent coordination of some of the speech sounds. Sometimes we see fast rushes of speech, sometimes we see slow speech, which affects the way that we communicate. So if you're experiencing any of these, it's really, really important that you see a speech pathologist as soon as possible, because I think we often have a tendency to wait for some of these issues to get bad enough. And when we do that, we're losing function as that goes on. And in that loss of function, it can actually cause us to socially isolate even more. So it's really important that when you start to develop some of these issues, you get right in, and maybe you don't need treatment, but an evaluation with a reassessment in the future is really beneficial to your journey with Parkinson's. So I'm sure many of you have heard of Lee Silverman voice treatment, LSVT Loud, a phenomenal research-based program. I'm certified in this program, and many speech therapists across Colorado are certified. It is an intensive treatment program. And for those of you who've gone through it, I'm sure you have had that intensity. So it's 4 times a week for 4 weeks. It's an hour-long session. There's daily homework and exercises. It's a lot about thinking loud, projecting your voice forward. And it really calibrates the self-perception of the volume of your voice. And we use that keyword, think loud. The good thing about LSVT Loud is they created a Loud for Life program, which some of you have probably participated in or are participating in. This again is a program that's like carryover or maintenance. So once we learn how to speak loud and think loud, we go into these groups, and these are social groups with other peers who've gone through the same treatment protocol, and it allows them to have carryover and practice that social and generalization piece from the intensive therapy that you received. Speak Out is another therapy program, research-based therapy program or protocol, I should say. And the key word in this therapy is speaking with intent, living with intent, speaking with purpose. Again, this is an intensive schedule. It's 3 times a week for 12 sessions. And it does that same principle of using your speech, speaking like you mean it, feeling in control of how you communicate. Both are excellent programs. I'm certified in both of them. And I know that, like I said, there's a lot of therapists in Colorado who are certified in these protocols, and they are the therapists that you should see because they know a lot about Parkinson's, they know about why these programs work, and we see great outcomes with people who do this intensive therapy schedule. And again, with Speak Out, the Loud Crowd is something that they have, and it's a carryover maintenance program. Again, it's a group of people who get together after they've done the one-on-one therapy, and they transition into these social generalization classes where you do the exercises together, and then you also do some social cognitive types of tasks, language-related tasks that are really beneficial to maintaining the progress that you made with the one-on-one. So in saying that, that's kind of my spiel of the importance of seeing a speech therapist. There are research-based programs out there that can benefit all of those areas for speech and voice. We know that 90% of people who have Parkinson's at some point in their journey will develop a speech and voice issue. So it's really, really important when you start to notice changes to get right in and start the intervention process early. I tell a lot of the patients that I work with, once I'm your therapist, I'm always your therapist until you choose otherwise. But I want them to feel like they've got control over their speech and voice, they've got better ideas to be social, and then they maintain that. And if they see me periodically throughout the year, just as a check-in or a recalibration time. It's very beneficial, and I've had patients that I've worked with for many, many years who are doing extremely well with their speech and voice, swallowing, and their socializing. So something to consider. There's a piece of the Speak Out program that I just want to talk about, and it's something that I've implemented into my practice a lot, and it relates to being social. But there's the extrapyramidal system and the pyramidal system in the brain. And the extrapyramidal system is really that automatic. It's things that we do that we don't think about: breathing, blinking, smiling, hand gestures, all of those things that are just regulated. And that track requires dopamine. So we know with Parkinson's, we're not producing enough. And so this is the system or track that really gets impacted. And when we talk about socializing, it is a pretty automatic function. You don't think about socializing, you just kind of do it. And once you stop being able to just do it, it becomes more methodical in how to stay social and what are some of the steps in order to maintain that. The pyramidal system is a system in our brain that doesn't require dopamine as much, and it allows us to say a message from our brain to our body, and we need to engage that system through intent. So I do like the word intention, purpose, control, because it really is a system in our brain that if we choose to take control, we can activate it. So if you've seen a physical therapist or a speech therapist or an occupational therapist, you know, oftentimes big arm swings, think about it, big steps, think about it, think loud. We're trying to calibrate this system in the brain to start doing things within your control. So I want you to kind of keep that pyramidal system intentionally programmed into your brain while I talk about the rest of the things in this session, in order for you to know that you really do have control over your ability to socialize. But we just have to maintain it, we need to practice it, we need to exercise it, and we need to do it with purpose. So let's just do a quick assessment. Now, I'm not going to be able to hear your answers, but if you've got a pen and paper, maybe just write down your yes or no to these questions. But I want you to think of them not what you used to be or what you think you are. I want you to really think about today. If I had to answer these questions, yes or no, just kind of evaluate your own performance. So, do you talk less than you used to? Do you look at your care partner or spouse or family or friend to answer questions on your behalf? Do you have someone else set up plans with friends and family? Do you feel stressed when getting together with people? Do you avoid calling or answering the phone? Do you let someone order for you at a restaurant? Or if you're getting to go, are they the ones making the phone call and you're not? Does someone else do most of the talking when you're in a doctor's appointment or with a therapist or other medical providers? Have you become a great listener? And do you struggle to initiate hobbies on your own? So you kind of saw this coming, but if you answered yes to many of these questions, it's time to make some changes. You know, the questions that I just asked you are common things that I hear from my patients. They'll say, you know, I just don't talk as much as I used to. I like to listen more. It's just easier if they talk. I can't always remember my medical history when I'm with the doctor. Oftentimes when one of my patients has been seen by their neurologist, they'll bring in a care partner in the room to explain what happened during the doctor's appointment. And so I want you, when I say I want you to make some changes, we're going to talk about ways to do that. But I want us to take some ownership of how are we losing our independence in socializing and communicating. So This is fair. Why do we socially isolate? Well, it's easier to not have to explain to everyone that we have Parkinson's. So if I don't get together with people or I don't call people, then they can't ask me questions. I don't have to explain. Logical. Sometimes just getting together or seeing or visiting people, the mobility and or cognitive changes that we experience make it, it's like, I don't want to go do that. This is uncomfortable for me, or I can't navigate through that restaurant, so I just would rather sit at home. Transportation is always an issue. If you're not driving anymore, how do you get to a book club or an exercise class if you don't have a ride? Just the simple fact of anxiety. Social anxiety is real, whether you have Parkinson's disease or not. And so it's a real thing for people. Low motivation, takes motivation to socialize for sure. Maybe you've had some really negative social experiences. So you've been in a group and you don't feel like you're communicating effectively. You can't find your words. People are talking over you. You try to initiate and nobody hears you. It can just make you feel like this isn't worth it. Not practicing being social. We'll get to this in a second. A pandemic that can actually socially isolate you. I think in the last year and a half, we've all experienced the ramifications of being socially isolated, and I think it's affected people with and without Parkinson's disease. And for me, my practice has moved to more telehealth, and sometimes I was the only social outlet for some of my patients that they had it for an entire 7 days. And so that really does isolate you socially, whether you want that or not. Obviously, like we talked about in the very beginning, speech and voice changes can impact your communication. If you're not being heard or you're not being understood, why socialize? And then too much to balance. I have so many patients say to me, well, so you want me to exercise 6 times a week and you want me to do speech every day and you want me to, and so it's like, when do I have time to make a phone call? When do I have time to do my hobbies? When do I have time to socialize? And so that's a piece of your care that you need to discuss with your medical providers in your life to make sure you're making time for this piece as well. So apathy, we know, the definition of it is lack of interest, enthusiasm, or concerns. It's a real thing. Apathy is really tough because it affects your motivation. And having Parkinson's, I think you've probably heard over and over and over, you gotta stay motivated, you gotta exercise every day. And with apathy, that makes it very challenging. And the definition of being sociable is willing to talk and engage in activities with other people. So engagement, willingness, those would kind of go against this apathy definition that we're just talking about. So you've got your work cut out for you. This isn't easy. Being social is not easy, especially when you're dealing with some of the things that we've discussed. So I think it's important, obviously, as you're watching me, you're probably like, that person is very extroverted. And so my baseline may be a little bit different than yours, but it's important to have that conversation. Today is a great day to start this conversation. What was I like? What did I used to do? Who is important in my life? Who do I want to stay in communication with? And kind of writing that plan out of what was your baseline performance prior to Parkinson's diagnosis. And as we know, in diagnosing Parkinson's, the day you got the diagnosis didn't mean that was the day you got Parkinson's. It means that you've been living with Parkinson's, but now finally somebody's acknowledging that you have it. So kind of figuring out who you are and doing a little self-assessment, like, what do I want to maintain in my life? What is important to me, and how do I exercise that? So this is probably pretty obvious to people, but social skills require nonverbal and verbal communication. So I've heard research and stuff that 90% of communication is nonverbal. Well, when you're dealing with Parkinson's and you have rigidity and you have hypomnemia with limited facial affect and you have more difficulty initiating those automatic functions like a smile and eyebrow raise and blinking, nonverbal becomes really challenging. And so 10% is verbal. Well, now if you're having trouble articulating words and using your voice with adequate volume, I mean, that really stacks the cards against us. So some things for nonverbal communication, and I want to bring these up because these are things that you have to practice and you have to exercise. Eye contact, facial expression, your gestures, touch, space, knowing how far you can sit from somebody and understanding that. I mean, nowadays it's 6 feet, but I mean, typical distance in communication is 3 to 4 feet. Paying attention and looking like you're interested in what the other person is saying, being engaged, and I think that goes along. Engagement is doing that back and forth in communication and not just turn taking, like it's your turn. Now it's your turn. There's just this nice little dance that we do in communication that can become really difficult. The verbal, you know, which I've discussed, but voice, articulation, the inflection in how you speak, the way that you engage people when you initiate conversation, and that initiating piece. You know, I often ask my patients, how many times did you ask somebody today how they're doing? And you know, the honest answer is I haven't done that today. So it's important that we practice that engagement, we practice that in initiating, and we need to do that with intention. We need to say, hey brain, ask somebody how they're doing and practice that skill. And then communication, you know, we talked about that apathy piece, and so now here are words that contradict that, but confidence, personable, clear and concise, topic maintenance, ability to find your words, recall what other people have said in the conversation, follow along and pay attention, initiate. I mean, those are challenging high-level functions that we have to do, and we used to do them so automatically. So to now kind of lay them out on these separate stairs, it's like, okay, I have to practice confidence. Now I need to practice engagement. Now I need to practice being clear and concise. So, you know, communication is tough. It's very difficult. And when you have it, you don't appreciate it. And when it's gone, it can be very, very frustrating. And it can be very isolating for sure. So active talking versus active listening. So when I use the word active, what I mean is doing that with purpose, that you're activating your talking and you're activating your listening. You need to do these things with purpose and effort. So if somebody's speaking to you, what does active listening look like? Active listening is nodding your head. You know, I'm agreeing with you, even if you're not, but just being responsive, taking a turn, not having long pauses in between conversations, or finding that the person is constantly asking you questions and you're not really giving the questions back. Maintaining eye contact is obviously a good nonverbal way of showing active listening. And, you know, recasting, I think, is something that I practice a lot, and I try to get my patients to practice. It's that you've said something and you want my opinion on the movie. You're almost giving that person assurance that you are understanding what they're asking or what they're talking about. Avoiding letting other people speak for you. And that's a tough one because, you know, your care partner may talk faster, have better word finding, be more sociable. And so it's easier to kind of pass the card and say, you take this. But it's important that if you're going to be an active listener and you're going to be an active talker, if you will, you need to be doing both, and you need to take control of that and hold yourself accountable. Interjecting. This one I hear so many times from my patients. They say, it's so hard for me to get into the conversation. Like I have something to say, but by the time, you know, it kind of goes around the table and it's maybe my turn, I don't know how to get in. Like and so then the conversation has already passed, and so it's not worth me talking. You've got to practice using the, excuse me, that's really interesting. Give me a second to think about that. Oh, wait, I have something to say. You have to practice these in a more structured environment or maybe task. So when you're in the conversation or in the game of communication, you're ready. You've got these in your back pocket. This is how I get my point in when I'm in a group setting, or even just over the phone or at home. And you know, as I say all of this, it's so easy for me to say it, and I know that. So I want you to realize it is exhausting to be social, and it is hard to stay engaged and be active all the time in communication. And so, especially when you're dealing with some of the things that we've mentioned, it is really exercise. So there is some research, there's tons of research, but there's a lot of research looking at social isolation and loneliness and kind of using those words interchangeably. And I think for my discussion today, I'm really talking more about social isolation, not loneliness, which is more of maybe a psychological state of mind, versus social isolation can occur because of the physical changes that Parkinson's causes. And it might not be because the person wants to socially isolate or they don't feel like they can socialize. It's more that these things keep kind of compounding and they lose the ability to socialize because it becomes more work than it's worth. So they also have researched the impact on care partners. And this slide to me really means a lot because as I've been doing more telehealth therapy sessions, I'm getting a lot more care partner engagement. So spouses, family members, friends are coming to some of these sessions, and I've participated in some support groups as well. And it's interesting when I ask care partners, what is one of the things that bothers you the most? That you would think it would be some of the physical limitations of Parkinson's, but most people report it's so hard because my loved one doesn't talk to me anymore. We don't have dinner conversation. We don't recap our day anymore. They don't ask me how I'm doing. And when we talk about social isolation for an individual who has Parkinson's, I think there's another component here of social isolation for care partners. And so if this person is not wanting to socialize or is having trouble socializing, I think it kind of just brings everybody to the same level. So it's really important that not only if you have Parkinson's, you're practicing socializing, but if you are with somebody who has Parkinson's, you're practicing socializing. And in the therapy models that we do for voice and speech, a lot of it is modeling. A lot of it is the therapist models, the patient imitates. And so if we want our loved one to be social, we've got to model social. So in these research studies, they did find that care partners were struggling with depression and anxiety and social isolation and loneliness because they weren't getting out anymore, because they were staying, not even getting out, but they weren't socializing with their group of friends because of this Parkinson's diagnosis. So I think it's important for care partners to play a very active role in this socializing and getting people out again. They are a model, so that's one thing that you can take responsibility for. Letting your loved one or friend or the person with Parkinson's struggle a little bit. It's okay. A little bit of struggling, if they're looking for a word, jumping in right away and not giving them an opportunity to find the word is actually debilitating to their language zone and finding words. And so it's really important that we kind of give a little struggle. Now, obviously, if it's a 10-minute struggle, we should kind of all help as communication partners, but it's really important to allow that person to be independent. Inclusion is a really good one. So when you're with a group of friends, maybe you've got more fast talkers or people who dominate conversations. Hey, Bob, what do you want to say about that? Bringing the person in, giving them an opportunity. And before you get into these situations, you may want to warn them, hey, during the conversation today, I'm going to be trying to bring you in. So be prepared, pay attention, be engaged. It's good because that's what socializing is. Repeat questions for the person. So if you're in a group and they get asked a question and you kind of see that, uh-oh, here we go, I got to think of something to say, give them an extra few seconds just by saying, Bob, can you tell us about what you really think about the menu? Or can you tell us about what you thought about that vacation? Just that recasting or giving that extra moment can make people feel more confident and be able to come up with the words that they want to express. And positive and safe socializing or social environments is so important. We don't want failures, we want success. And so here are some ideas for increasing your social. Now, everyone is probably at a different stage here. Some of you may be sitting here and going, I'm social, I haven't lost any of those things, so this is kind of common sense. Some of you may feel, you know what, I'm noticing I'm not doing as many things as I should, or I'm not staying engaged in conversations, or I've lost some of my friends. This is a way to establish a plan for that. So maybe this time when you get together with family or friends, you're the one who makes the phone call. You set up, you know, the event, and maybe it will take being on speakerphone where both of you, your care partner and yourself, are planning that together. But that can be really beneficial to kind of show that engagement, that initiation that you're wanting to socialize. Again, with the pandemic, going out to restaurants and things like that are more challenging right now, but try Zoom. I mean, you could do a virtual meeting, you could set that up, make a phone call before. If you feel more comfortable having people at your house, that is fine. The going and getting together with people, if you choose a restaurant, restaurants, as you know, are very loud places. There's a lot going on. It's very distracting. And so it might not be a bad idea to go to that restaurant before you get together with friends or family to just see, what is the environment like? What am I going to need to do in order to stay socially engaged? Making sure that there's accommodations for any physical limitations you may be experiencing. Reviewing the menu before you go is a really great idea. You probably shouldn't take on, you know, a dry chicken breast or a steak during a meeting with friends, because you've got to be focused on the conversation. And we know with swallowing, we want you focusing on chewing and swallowing. So maybe look over the menu. What's something easier, like a pasta or something more soft that can make you still stay engaged and not so focused on the food or eating, swallowing part. Prior to going, go over the names of everybody coming to the event. If it's one person or five, you know, think about their history a little bit. They've got 2 kids, they're in college, they've got a dog, think about those things. So you're already marinating on the ideas of asking questions about who these people are and staying engaged. Like I said, practice questions, maybe even go through some of those, like what university is your grandson at? And then think about topics in your life. You know, how are you? I'm fine. Okay. And what's fine in your life? So maybe thinking about how you can elaborate on some of the things that are going on your day-to-day. And on that day when you're going to be social and we're exercising, that's not a great day to be in 5 exercise classes and then plan to go to dinner at 7 o'clock when you're already fatigued and tired. So trying to set times during the day that would make it better for you to make a phone call or get together with friends or have people over, and try to, you know, feel rested and prepared for that social exercise that you're going to be doing. You know, I think it's really important that we think about that automatic system versus that intentional system. And if we don't use these social skills, there's a chance we can lose them. And once they're gone, it's a lot harder to get them back because you lose practice. I always tell patients of mine, we've got to practice the social so you stay in the game. So sometimes we go and we create social opportunities, make a phone call, write an email, send a text message, just to practice and exercise creating that engagement and keeping that social piece. I think what happens is we experience some of the voice and speech changes, maybe some of the psychological changes, the apathy, the things that are going on, and that social isolation is going. And by the time we get in for therapy or we get back into a social, we've already lost a lot of our confidence in socializing. And so right away, early is better. We want to keep this function. We've got to exercise and practice this function because, like I said, if you don't use it, you could lose it. So some ideas for social opportunities. I think, you know, if right now I do 3 social things a week, we're probably doing great. I mean, if I do 1 a month, we're probably not doing as well. So create 1 on a weekly basis. Depends on where you're at. If you're already at 3, maybe make it 4. Push yourself a little bit. I have a lot of people report to me going to the dog park or walking their dog has a great way of having social encounters with people, being engaged. People love talking about their dogs and their kids, so that's a good way of engaging and having social opportunities. Going to the grocery store, making an effort to talk to somebody, make it a personal goal. I'm gonna say hello to the cashier. Maybe I'm gonna ask them, how they're doing, or tell them a quick joke or something. Go in there with a plan to engage and socialize if you can. Make the to-go order. If the family is gonna order something, you're the one who makes the phone call, and do that with intention and good speech and voice and the things that you may be practicing with your speech therapist. You wanna call a friend or family member one time a week. You can even call that friend and say, hey, my speech therapist is telling me I need to work on this. I'm making a phone call once a week to check in. It can be 5 minutes, but it's engaging, it's exercising that initiation piece. So it's really important. There's tons of online forums. Obviously, the Parkinson's Association of the Rockies has tons of resources for people and community classes and things like that. Be aware of your local newspapers or events, or watch the news to see what's going on in your community. I know with COVID, there's not as many things going on, but just kind of looking and seeing if there's something you can participate in. Go to coffee with a person, take a class at a gym. YouTube has been a great resource. There's actual social videos on there that practice that back and forth question asking. So it's not a bad idea to kind of use those resources. Like I said, technology. So, with the pandemic, a lot of people are not going to restaurants as much, but we have FaceTime and Skype and Zoom. Sending an email is great for your fine motor skills. Social media platforms like Facebook, Instagram, all of those are great ways of staying in touch with people. It may not necessarily be verbal, but at least you're engaging some social back and forth with people. I don't know if you've heard of like online games, Words with Friends, but that's a great kind of back and forth between two people. There's applications for social starters. Would You Rather is a really fun game that you can play with family, just to kind of get that engagement and that initiation piece. So I think just to kind of summarize everything that we talked about today, first off, this isn't easy, and I know that. And I think it's something that when you don't practice it, there's a chance that you're going to lose it. So it's really important that you're honest with yourself. You set some realistic expectations, talk to people who you know, and ask them, do you see that I'm talking less? Do you see that I don't really engage people? Do you see that I'm not asking questions? If that is the case, it's good to break that down and start practicing. So maybe at night or every day, 5 minutes, we're gonna do a back and forth. And I looked up these questions online, and I'm gonna ask you those questions. Or you could play a game of what's your favorite, or something that gets you to initiate and get confident, feeling like when I wanna talk, I can speak like I mean it. And that's something that is really, really important to continue to practice, because once you become a great listener, it's a lot harder to initiate. Establish a social plan. What am I gonna do? What is my weekly goal for my social? And not only just social, but hobby. I think that's something that I see a lot in people that I work with, that they used to be really good at something. They loved cycling, or they loved going to the gym, or they liked woodworking or art or something. And it's, since they've gotten the diagnosis, they're like, well, I just don't really want to do it, or I don't feel motivated to do these things. It's so important that even if you don't want to, you need to. So maybe not getting on your bike and going downhill on a mountain, that's probably not the best idea, but maybe getting a stationary bike where you ride at home, or going for a hike just to get outdoors and enjoy the things that you enjoyed before. Just because you have Parkinson's doesn't mean it is what you are. And so you need to keep staying with, who am I? What do I enjoy? What do I like to do? And that can really help with the mental piece of anxiety and depression that can go along with Parkinson's. I've mentioned this before, but creating positive social opportunities, that is on you and your care partners to make sure that you go into things with positive opportunities for both, because a large group in a loud restaurant probably isn't the best place to start. So kind of, you know, depending on where you are on this spectrum, figuring out what's the next step from here. Okay, I don't make phone calls. I'm going to try doing that. Oh, I don't answer the phone. Okay, I'm going to try doing that. Oh, I don't send emails. Okay, I'm going to try to do that. Kind of working your way up that ladder. Make it a routine. So just as you physically exercise, just as you do speech and voice, just as you do hobbies or whatever you enjoy, this needs to be part of your routine. It needs to be done on a weekly basis. And look, if you find no motivation to socializing, look at it as exercise. It is an opportunity to exercise your language abilities. It's an opportunity to exercise your cognitive abilities and processing. It's an opportunity to exercise your facial expression, your body posture, your mobility. It's a really great way, and hopefully you have some fun with it, to kind of get all of those pieces exercising. So these are just some resources. Obviously, you guys know about the Parkinson's Association of the Rockies. There's tons of resources online talking about socializing and ways to keep that going. I just kind of put this up just to remind, and I'm sure many of you participate in classes, but since I've gotten involved with the Parkinson's Association of the Rockies, it's encompassing how many classes they offer to people with Parkinson's. I mean, there's really not an excuse to not take an exercise class. There's just so many available. And these are kind of the references. So that is all that I have. I know that Emma had mentioned that we were going to kind of have a question answering session.
Yes, so far there's no questions, but just a reminder, you can chat it in the questions bar or raise your hand and I will unmute yourself. That was wonderful. Thank you, Rachel.
Yeah.
Right.
Should I close the screen on here?
Yeah, I could take over the.
Okay, great. Yeah.
All right. You'll be able to see my screen. These are just two of the upcoming webinars for December. Deep brain stimulation, sponsored by Abbott, and then chronic drooling in PD patients and how Mybolic can help, sponsored by Supernus. Both of those webinars will be wonderful, and both of those webinars will not be recorded. All right. Still no questions. Do you have any last minute thoughts, Rachel?
You know, I think it's really, really important. And I think the more social you stay, the other issues that can come along with speech and voice, maybe you can avoid those longer or never even develop them, because you're staying active and exercising all of those functions that you might not even be thinking about.
Perfect. We have a question pop up from Colleen. Colleen, if you want to unmute yourself or connect to audio, I don't know if you've connected yet. What kind of, see, that might have been a mistake. We have a comment saying, excellent, lots of good suggestions.
Thank you.
Oh, we have one more question. Oh, man, that was, okay. All right. Well, if there's no more questions, thank you everyone for joining us. If you joined late, this will be uploaded to our YouTube in the next day or so. So you can rewatch it if you need. And again, please take that survey at the end. That'll pop up on your screen, or it'll be sent to your attendance email. And with that, thank you so much, Rachel. That was again wonderful. And I hope to see you all again for our upcoming webinars. All right.
Thank you.
Bye.